I am happy to talk to you this afternoon about a hot topic in pediatrics, one that is gaining national attention, and that is of toxic stress and childhood adversity. I have no disclosures. Our objectives for this session are to understand the different forms of stress, identify risk factors for toxic stress, understand basic biology behind toxic stress and its consequences, understand resilience, discuss some possible screens for toxic stress, and then meaningful interventions. We all experience stress. Stress is a part of human existence, and in its most positive forms, it can be protective. So as we look at these different forms of stress, positive versus tolerable versus toxic, it is important for us to remember that it's the response to stress that determines which category it falls into, and not the stressor itself. So in dealing with positive stress, some examples in the literature for children are vaccinations or the first separation from a family member, whether it's the first day of daycare or first day of school. And the idea is that the way we are designed, our hypothalamic pituitary adrenal axis gets activated so that our cortisol levels rise, the adrenaline rises, our heart rate increases, and we're geared, ready to face that stressor. But that whole system is designed for a short-lived experience. So if the stressor is a short one, we face it and then our body returns to baseline, then that is considered a positive stress. And in this talk of stress, the important buffer for making it a positive experience is the presence of a supportive, consistent caregiver. So when we look at the other two categories, that of tolerable versus toxic, some examples of the tolerable stress mentioned in the literature are divorce of parents or death of a loved one or a serious childhood illness. So a little more prolonged stress response. But again, if there is a consistent relationship with a supportive caregiver, then those hormone levels return to baseline, the child recovers, and that would be a tolerable stress. So what is toxic stress? That is when the stressor is so pervasive that HPA axis is activated all the time. It stays up. So the adrenaline never goes back to baseline. The cortisol is elevated. And so over time, we know that this can lead to actual brain changes, and we'll discuss that a bit later. But we also know that this can cause destructive habits in people and lead to detrimental health effects for the lifespan, and definitely affects learning and behavior, because keep in mind this is early childhood when these are happening, so that's when the brain is developing. So we're going to look at a video from the Harvard Institute of the Developing Child.
Learning to deal with stress is an important part of healthy development. When experiencing stress, the stress response system is activated. The body and brain go on alert. There's an adrenaline rush, increased heart rate, and an increase in stress hormone levels. When the stress is relieved after a short time, or a young child receives support from caring adults, the stress response winds down and the body quickly returns to normal. In severe situations, such as ongoing abuse and neglect, where there is no caring adult to act as a buffer against the stress response stays activated. Even when there is no apparent physical harm, the extended absence of response from adults can activate the stress response system. Constant activation of the stress response overloads developing systems, with serious lifelong consequences for the child. This is known as toxic stress. Over time, this results in a stress response system set permanently on high alert. In the areas of the brain dedicated to learning and reasoning, The neural connections that comprise brain architecture are weaker and fewer in number. Science shows that the prolonged activation of stress hormones in early childhood can actually reduce neural connections in these important areas of the brain at just the time when they should be growing new ones. Toxic stress can be avoided if we ensure that the environments in which children grow and develop are nurturing, stable, and engaging.
What puts children at risk for toxic stress? We know that childhood adversity does, and so we need to talk a little about the now famous ACE study of the 1990s, which was in part with CDC and the Kaiser Permanente and two doctors, Robert Onda and Vincent Felitti. But before we get into the ACE study, let me give you a little background information that kind of sparked the interest of Dr. Felitti. So he's a physician in California and was working with obese patients in this weight loss program. And the program was very successful. These people had lost a significant amount of weight, but then people began dropping out of the study at an alarming rate. And he was very curious as to why this was happening and perplexed by it. So he began meeting with the participants in one-on-one interviews, and he stumbled upon an answer of childhood sexual abuse in one participant, and then he began to realize that that was a common thread of these participants. And as he talked to these participants, it seemed as if the food and the weight gain became an escape from that trauma. And so what he and we may consider a public health problem had become an answer, an escape, a relief, a solution in these personal situations. So keep that in mind. So then in the 1990s, they looked at 17,000 plus individuals. In this original study, they're not taking any more participants, but they are continuing to study the results of these participants. And this particular population was 70% college educated and Caucasian. And even in that population, the ACEs were very common. So there were 10 that were identified in this study: physical abuse, emotional abuse, and sexual abuse, physical or emotional neglect, incarceration of a parent, divorce of the parents, mental illness of a parent, domestic violence, particularly toward the mother, and drug use of the parent. And in that original study, as I said, they were very common. So over 67% of that population had at least one of these to occur before the age of 18. And over 12% had 4 or more. And what they have noted is that there is a dose-response relationship to the number of childhood adversities that occur and the lifelong detrimental health effects. So that the more ACEs a child experiences in early childhood, the more likely, the greater risk of poor health outcomes over the child's entire life. And if we look at some national and state data, we can see that Kentucky is higher than the national average in people experiencing 2 or more adversities during childhood. And what happens to the brain because of this? So if you look at this picture of the brain, toxic stress triggered by these adversities can lead to actual changes in the brain structure such that the prefrontal cortex, that area in blue, shrinks. And the prefrontal cortex is crucial for executive function, for planning, for impulse control. So think about all these things as you recall children that you may see who the teachers are having trouble with behaviors, those who may be labeled as bad kids or behavior problems. So the prefrontal cortex, again, is what is needed for planning, impulse control, self-control. And then the amygdala is that circular area below, and that is the area of the brain that is important for emotions, so the fear response. There is, not very good at this, the amygdala, so the fear response of the brain. So in these children who have toxic stress, those hormones are on all the time. That cortisol level is up, the epinephrine is up, and so they are more prone to react to a fearful stimulus, even if it's not a fearful situation, because of these changes. And then that area underneath, the hippocampus, is impaired as well, and that is important for memory and learning. So you can see that children with academic difficulties and behavior problems could have at the root of their problems childhood adversity and toxic stress. So what are the consequences? Well, in this original ACE study, they found that the more ACEs a child experienced, the more negative, unhealthy behaviors a person engaged in. So that could be early alcohol initiation, drug use, tobacco use, violent crime. But keep in mind that for those individuals, it was a coping practice, a solution to escape from that stress and trauma. We also know that these problems are cyclical, and so there's a big push to two-generational model to look at the parent as well as the child, because if the parent had a high ACE score, then the child is going to suffer as well, because that parent may not have had positive parenting modeled for them, so they don't know how to parent the children. And so these social problems that we might label of school failure, unemployment, homelessness, poverty, single parenting can also be a consequence of childhood adversity. And then medical comorbidities. And it's easy to think, well, of course there's going to be a greater incidence of hepatitis if all of these people are turning to alcohol, or of course there's cardiovascular disease if they're turning to cigarettes. But taking those unhealthy behaviors out completely, the data still supports that there are negative health outcomes. So even in those participants who did not engage in any unhealthy behaviors, their rates for cardiovascular disease were still higher than the general population. So this data is pretty startling and fairly common. Again, in that original study, over 67% of the population had at least one childhood adversity. But we do have hope, and that hope lies in resilience. So if we think about resilience, bouncing back, but what else does it truly mean? Some definitions are a set of skills needed to respond to adversity and thrive, a good outcome despite adversity, or staying calm and in control when faced with a challenge. So we're going to look at some other videos from that same Harvard Institute of the Developing Child.
Why do some people do well despite serious hardships? The science of resilience can help us find answers.
We define resilience as a good outcome in the face of adversity. The extent to which we can build capacities in all children early in their lives to be able to deal with whatever bumps in the road or major obstacles may be coming down the track. That's an investment in building strong human capital and healthy, productive adults.
Some children face more obstacles and adversity than others.
Like having a parent with a major mental illness. growing up in a very socioeconomically disadvantaged community, going to schools that are not good, being exposed to violence in the neighborhood or in the home.
But some children do well despite these significant obstacles.
Resilience is that ability or set of capacities for positive adaptation, allowing you to keep in balance.
We're talking about the kinds of capacities and skills and the abilities that give people a sense of mastery and management of difficulty.
It's tempting to think about children as either having this resilient quality or not. But resilience is built over time, just as an parallel with how the architecture of the brain is built over time.
It's not just in the person. It's in the interaction between the person and the community.
So we care about resilience for the same reason that we care about promoting healthy development, because in many respects it is the same. We are interested in promoting resilience in children so that, despite the odds, more and more children can grow up to be productive citizens.
One way to think of resilience is transforming toxic stress into tolerable stress. Again, remember back to at the beginning of this talk, it depends more on the response, the stress response, than the stressor itself. So transforming toxic stress into tolerable stress, or keeping it at the tolerable stress and never getting to the toxic stress. And as we mentioned earlier, the important buffer that we know can do that is through a supportive, consistent relationship with an adult caregiver. And it doesn't have to be the parent, because unfortunately that caregiver, it could be the one who's instigating the stress through abuse and neglect. So it can be other people in the community, teachers, nurses, physicians, coaches, who can fill that role to be a positive mentor in these children's life and to help build resilience.
Resilience is the result of a highly interactive process between individual characteristics in the person and the environment in which that individual has developed.
It's really the counterbalancing of difficult things that may exist in a child's life with positive things that occur within the family, but even positive things that may exist in the community.
An easy way of thinking about resilience is like a scale with a fulcrum in the middle of it. And there are things on both sides of that scale, experiences of both bad things or good things.
Our genes shape where the fulcrum is positioned at the start.
There are certain genes that make a child more sensitive to the effects of maltreatment or parental neglect or witnessing violence.
The fulcrum may start out kind of more towards one side or more towards the other side, and that's going to make a big difference in terms of how much these subsequent events affect things cognitively and behaviorally.
Science tells us that experience moves the fulcrum, for better or for worse.
Even though we are born with genes, genes will respond differently to certain environmental situations from others.
What the genes are actually doing are turning up or turning down the expression of chemicals and circuits in the brain and circuitry in the entire body that govern our responses to stress, to anxiety, to depressive symptoms.
When positive experiences accumulate and children learn coping skills that help them to manage stress, the fulcrum can slide, so the scale tilts toward positive outcomes more easily. That's what resilience is all about.
There's always an adult, or more than one adult, who is key to providing that relationship that helps to build resilience.
We've talked about relationships and how important that is for resilience. Another key aspect is teaching skills of executive function, because as you remember, the prefrontal cortex has suffered because of this toxic stress, and so those skills have suffered as well. So teaching children working memory, mental flexibility, self-control, procedural self-talk, to break down tasks into little steps, all of that is important as well.
Resilience is not some magical quality. It's something that really can be built, even in difficult circumstances.
A key active core ingredient to building resilience are the relationships kids have to others who care about them.
Of course, families play a very important role, but nobody raises children in isolation. We have a huge amount of research to show the powerful impacts of teachers, coaches, other adults in the community with whom children have a chance to develop relationships, who play that critical supportive role of building resilience. As a result of responsive interaction, children build simple skills of coping and adapting, how to stop crying, how to regulate their behavior, being able to defer gratification.
You have an adaptive toolkit that allows you at moments of stress or challenge to bring out a number of potential skills that allow you to get through it.
As children get older, the sophistication of those skills increases. Being able to monitor situations, solve problems. The way we as a society can nurture the development of resilience is to help communities to pay more attention to building the capabilities of the adults who care for children and provide the supports they need to tip the scales toward more positive life outcomes.
And I'm a community saying we want to be an active part of crafting a solution to really understand what's necessary to produce the resilience. That's when the ball gets rolling.
Resilience building, capacity building is really in everyone's interest, and everyone reaps the benefits when you do that well.
Another aspect is to ensure that children have a sense of self to prevail in the midst of adversity, and that might mean ensuring that they are plugged into their own cultural traditions or to a faith community. This last video illustrates a tool, a particular skill called serve and return that we could easily teach our parents to help their children's brain development.
The key to forming strong brain architecture is what's known as serve and return interaction with adults. In this developmental game, new neural connections form in the brain as young children instinctively serve through babbling, facial expressions, and gestures. And adults return the serve, responding in a very directed, meaningful way. It starts very early in life when a baby coos and the adult interacts and directs the baby's attention to a face or hand. This interaction forms the foundation of brain architecture upon which all future development will be built. It helps create neural connections between all the different areas of the brain, building the emotional and cognitive skills children need in life. For example, here's how it works for literacy and language skills. When the baby sees an object, the adult says its name. This makes connections in the baby's brain between particular sounds and their corresponding objects. Later, adults show young children that those objects and sounds can also be represented by marks on a page. With continued support from adults, children then learn how to decipher writing and eventually to write themselves. Each stage builds on what came before. Ensuring that children have adult caregivers who consistently engage in serve and return interaction, beginning in infancy, builds a foundation in the brain for all the learning, behavior, and health that follow.
To build resilience in children, we know that relationships are important with that consistent, supportive caregiver. We have to ensure that the built environment is safe and supportive, and that we are teaching these skills of executive function. Also, skills that Paul Tough, author of How Children Succeed, talks about as non-cognitive skills. And Kenneth Ginsberg is a pediatrician who coined the 7 C's of resilience. And these are listed here: competence, confidence, connection, character, contribution, coping, control. Paul Tough talks about these skills being as important, if not more so, in ensuring that children succeed, stay in school, go to college, get a job, than the traditional reading, writing skills. We do have some screening tools that are occurring now, some that are on the horizon, and clinicians are looking at it from different perspectives, but some are screening for the actual ACEs, the adverse childhood experiences from that original study in the 1990s. Some are looking at the parent's ACE score because, again, this 2-generational model, what the parent experienced definitely affects the child's well-being as well. A pediatrician in California by the name of Nadine Burke-Harris has done a lot of research in this area, and her clinic is now very oriented toward addressing the needs of children who have suffered trauma. And so her system is to ask the parent to complete a screen, basically an ACE score, but it's de-identified. So she just wants to know how many of these have occurred in your child's life, because statistically she knows if that score is 4 or higher, they have a much greater risk of adversity later in life, as we talked about on previous slides. And for example, she knows that a teenage female who has a high ACE score, she definitely needs to be on birth control because of the higher rate of teen pregnancy. The SEEK, S-E-E-K, Safe Environment for Every Kid, is one tool that is used. It's basically a series of questions for parents to answer, ranging from, do you have a smoke detector in your house, so ensuring adequate resources are in the house, to screening them for drug abuse themselves. The Survey of Well-Being of Young Children incorporates a developmental screen along with a social screener. The Yale Vermont Adversity in Childhood Scale is a more in-depth system of childhood adversity. And then Bright Futures with the American Academy of Pediatrics should be coming out soon with more of a strength-based screening, so really looking at the resilience side as well. And how do we intervene? So anticipatory guidance is important. We can educate on the importance of sound nutrition, good exercise, good sleep to mitigate negative effects that these children might be at risk. But we also are in need of a multidisciplinary collaboration to ensure that parenting classes are held, that counseling is available for the children as well as the parents and families as a whole. So we need social services, care coordination, home visitation, and another hot topic is mindfulness. And there are some programs geared in the school, particularly one in Rhode Island, where they have sessions of mindfulness within the school, and it's been pretty successful. So that is another. To conclude, we know that adverse childhood experiences can lead to toxic stress, and that can set a child up for negative lifelong consequences, beginning with actual structural changes in the brain that is developing. We also know that resilience can mitigate these detrimental effects, and so it is our responsibility to screen and intervene to promote resilience and thus overall health. Thank you.